Bismillahirrahmanirrahim. Today I am going to discuss adrenocortical hormone, which are aldosterone, also called mineralocortical hormone, glucocorticoid, and androgen. Glucocorticoid is also called cortisol, and androgen, steroids, and DHEA, dehydroepiandrosterone. So today we will discuss adrenal medulla and its hormones. Location of the adrenal medulla. The adrenal gland, also known as suprarenal gland or endocrine gland, it is endocrine in nature. The two adrenal glands are situated on the upper pole of the kidney, one on top of each kidney. You can see this kidney, and on the top of each kidney on the right and left side we have this gland. They are divided into two zones. This gland is divided into two zones. The cortex, the largest part of the gland, this is the cortex, which is the largest part of the gland, and the medulla, the smaller inner part. This is the medulla or inner part of the gland. The adrenal gland are approximately 5 cm in length, 3 cm in width, and up to 1 cm in thickness. Their combined weight is in adult human range from 7 to 10 grams. The weight of both glands is 7 to 10 grams. The glands are yellowish in color. You can see here that it is yellowish in color. Zone of adrenal cortex. The adrenal cortex itself is divided into three main zones. You can see this is the capsule, and these are the three zones of the gland. The zona glomerulosa. The upper zone is called the zona glomerulosa. Why it is called zona glomerulosa? Because it looks like the glomeruli. It has vessels or blood vessel in the center of its cells, and it looks like the glomerulus. That's why it is called zona glomerulosa. Zona fasciculata. The inner or the middle zone is called zona fasciculata because its cells are arranged in fascicle or linear fashion. And the zona reticulosa, the innermost zone of the cortex is called zona reticulosa because the cells look like in a reticular fashion. Adrenal medulla. The adrenal medulla is at the center of each adrenal gland and is surrounded by the adrenal cortex. This is the central point or central area of the adrenal gland, and it is surrounded by the adrenal cortex. The chromaffin cell of the medulla are the body main source of the catecholamines such as adrenaline and noradrenaline released by the medulla. This is the main source of catecholamine, which are adrenaline and noradrenaline, and released by the adrenal medulla. Approximately 20% noradrenaline, norepinephrine, and 80% adrenaline or epinephrine are secreted here. From here, 20% noradrenaline and 80% adrenaline is secreted from this area or medulla of the adrenal gland. These play a crucial role in stress response and regulate body pressure and heart rate. They also function as neurotransmitter. The two hormones secreted from this zone, they regulate the blood pressure, heart rate, and also play a role of neurotransmitter. The adrenal cortex has three distinct layers. These are the three distinct layers. The adrenal cortex produce three main types of steroid hormone. These layers produce three main type of steroid hormone, which are mineralocorticoid, glucocorticoid, and androgen. Mineralocorticoids such as aldosterone produced in the zona glomerulosa help in the regulation of blood pressure and electrolyte balance. It acts on the kidney and regulate the blood pressure and electrolyte balance. The glucocorticoid, which is also called cortisol and cortisone, are synthesized in the zona fasciculata. Their function include the regulation of metabolism and immune system suppression. They cause suppression of the immune system and also regulate the metabolism. The innermost layer of the cortex, the zona reticularis, produce androgen that are converted to fully functional sex hormone in the gonads and other target organ. The production of steroid hormone is called steroidogenesis. The medulla produces the catecholamine, which function to produce a rapid response throughout the body in stress situation. Blood supply of the adrenal gland. The adrenal gland is high vascular. As many as 50 arterial branches provide its blood supply. 3 arteries usually supply each adrenal gland. The suprarenal artery, a branch of the inferior phrenic artery. Suprarenal artery. The middle suprarenal artery, a direct branch of the abdominal aorta. This is from the abdominal aorta. The inferior suprarenal artery, a branch of the renal artery. These blood vessels supply a network of small arteries within the capsule of the adrenal gland. This strand of capsule enter the gland carrying blood to them. Here they make a meshwork, and from this the vessel then enter into the cortex and supply the gland. Hormone produced by the adrenal cortex, aldosterone, which is also called mineralocorticoid hormone, regulate blood pressure and blood pH level. The hormone regulate electrolytes such as sodium and potassium in the blood to maintain blood pH. Cortisol, glucocorticoid hormone, control the use of carbohydrate, protein, and fat by the body. It regulates blood pressure, blood glucose, and decrease bone function. Cortisol also helps in suppression of inflammation in the body. Androgenic steroid and DHEA, dehydroepiandrosterone, help in the production of sex hormone. Adrenal gland, its hormone and site of action. In this picture you can see that the zona glomerulosa secrete aldosterone and it acts on the kidney. The zona fasciculata, the middle zone, it secretes the cortisol and it acts on the liver, and the zona reticulosa, which secrete androgen and act on the act in male on testes and on the female genital organs. Mineralocorticoids. The adrenal cortex produce aldosterone, a mineralocorticoid which is important in the regulation of salt, mineral balance, and blood volume. In the kidney, aldosterone acts on the distal converging tubule and collecting duct by increasing the absorption of sodium and the excretion of both potassium and hydrogen ion. Aldosterone is responsible for the reabsorption of about 2% of filtered glomerular filtrate. Sodium retention is also a response of the distal colon and sweat gland to aldosterone receptor stimulation. Angiotensin II and extracellular potassium are the two main regulators of aldosterone production. The amount of sodium present in the body affects the extracellular volume, which is in turn influence blood pressure. Therefore, the effect of aldosterone in sodium retention are important for the regulation of blood pressure. Glucocorticoids. Cortisol is the main glucocorticoid in human. A circulating level of glucose. When glucocorticoids are released, they increase the glucose. This is the result of increase in the mobilization of amino acid from the protein and stimulation of synthesis of glucose from these amino acids in the liver. So it is a source of gluconeogenesis. It makes glucose from protein and mobilization of protein from other part of the body. They increase the level of free fatty acid, which cells can use as an alternative to glucose to obtain energy. Glucocorticoids also have effect unrelated to the regulation of blood sugar level, including suppression of immune system and a potent anti-inflammatory effect. So, anti-inflammatory effect and regulation of blood sugar level. These are the other function of glucocorticoid. Cortisol reduces the capacity of osteoblasts to produce new bone tissue and decrease the absorption of calcium in the gastrointestinal tract. The adrenal gland secrete a basal level of cortisol but can also produce bursts of the hormone in response to adrenocorticotropic hormone ACTH from the anterior pituitary. Cortisol is not evenly released during the day. Its concentration in the blood are highest in the early morning and lowest in the evening as a result of the circadian rhythm of ACTH secretion. So here you can see the cortisol act on the pancreas, increase release of insulin. It mobilizes protein from the muscles, and it on the liver when it acts, it causes synthesis of protein, synthesis of glucose from other components of the body like protein, and also mobilize fats and use it as energy by the body, and decrease deposition of calcium in the bone and make the bone weak and fracturable. Mineralocorticoid secretion regulation. Mineralocorticoid secretion is regulated mainly by the renin, angiotensin, aldosterone system, the concentration of potassium, and to a lesser extent the concentration of ACTH. Sensor of blood pressure in the juxtaglomerular apparatus of the kidney release the enzyme renin into the blood, which start a cascade of reaction that lead to formation of angiotensin. The angiotensin receptor is in cell of the zona glomerulosa recognize the substance, and upon binding they stimulate the release of aldosterone. Glucocorticoid, at least 95% of the glucocorticoid activity of the adrenocortical secretion result from the secretion of cortisol known as hydrocortisone. Small but significant amount of glucocorticoid activity is provided by the corticosterone. Effect of cortisol on carbohydrate metabolism. Stimulation of gluconeogenesis, formation of carbohydrate from protein and some other substances by the liver. Cortisol increases the enzyme required to convert amino acid into glucose in the liver. In the liver, the enzymes which are responsible for conversion of protein to glucose is increased. Cortisol causes mobilization of amino acid from the extrahepatic tissue, mainly from the muscles. So mobilization from the extrahepatic tissue. It causes mobilization of protein from the extrahepatic tissue. Mark increase the glycogen storage in the liver cell. The effect of cortisol allow other glycolytic hormones such as epinephrine and glycogen to mobilize glucose in time of need, such as between meals. So this hormone is also responsible for the storage of glycogen. Decrease glucose utilization by cell. Cortisol also causes a moderate decrease in the rate of glucose utilization by most cells in the body. Cortisol directly delays the rate of glucose utilization. Glucocorticoid depress oxidation of nicotinamide adenine dinucleotide NADH plus hydrogen to form NAD. And due to this non-conversion of NADH to NAD, this effect accounts for the diminished utilization of glucose by the cell. Elevated blood glucose concentration and adrenal diabetes. Both the increased rate of gluconeogenesis and the moderate reduction in the rate of glucose utilization by the cell cause the blood glucose concentration to rise. There is increased production of glucose and less utilization of the glucose when there is high concentration of cortisol, so it leads to adrenal diabetes. The rise in blood glucose in turn stimulates secretion of insulin. When the blood glucose level is increased, there is release of insulin from the pancreas. The increased plasma level of insulin are not as sufficient in maintaining plasma glucose as they are under normal condition. Normally, when there is increased glucose level, insulin is released and the glucose level is normalized. But in this condition, in adrenal diabetes, the increased level of glucose is not bring down to the normal level by insulin. For reasons that are not entirely clear, high level of glucocorticoid reduce the sensitivity of many tissue, especially skeletal muscle and adipose tissue, to stimulatory effect of insulin on glucose uptake and utilization. As we know that when the insulin is released, the glucose is taken by the skeletal muscle and adipose tissue. But in adrenal diabetes, this effect is reduced, and the reason is not clear, but the utilization of glucose by the skeletal muscle and adipose tissue is reduced, and it leads to the adrenal diabetes. The increase in blood glucose concentration is occasionally greater enough 50% or more than the normal, that the condition is called adrenal diabetes. Administration of insulin lowers the glucose concentration only a moderate amount in adrenal diabetes, not nearly as much as it does in pancreatic diabetes, because the tissue are resistant to the effect of insulin. When there is pancreatic diabetes, the pancreas is not producing insulin, and when insulin is injected, it reduces the blood glucose level, but in case of adrenal diabetes, administration of insulin does not reduce the blood glucose as efficiently as it is in the pancreatic diabetes. Effects of cortisol on protein metabolism. Reduction in cellular protein occur especially in all body cells except those of the liver. In all cells the protein concentration is decreased except the liver because the protein is mobilized towards the liver. This is caused by both decreased protein synthesis and increased catabolism of protein in the cell, decreased amino acid transport into the extrahepatic tissue, depress the formation of RNA and subsequent protein synthesis in many extrahepatic tissue, especially in muscle and lymphoid tissue. There is a decrease in synthesis of RNA, so there is a decrease in synthesis of protein. The muscle can become so weak that the person cannot rise from the squatting position. This is the squatting position, and he becomes so weak that when he is put in squatting position, he is unable to rise up from this position. Effects of cortisol on fat metabolism. Mobilization of fatty acid promote mobilization of fatty acid from adipose tissue. This increases the concentration of free fatty acid in the plasma, which also increase their utilization for energy. So, in spite of glucose, the body starts using the fatty acid. Shift the metabolism system of the cell from utilization of glucose for energy to utilization of fat acid in time of starvation or other stress. So this mechanism occurs during starvation or in other stressful condition. Obesity caused by excess cortisol. Excess cortisol secretion develop a peculiar type of obesity, which with excess deposition of fat in the chest and head region of the body, giving a buffalo-like torso and around more fat. This is a buffalo deposited in the chest and on the back, and it makes a buffalo-like torso and moon shape. This is, you can see that this is moon-like. ACTH effect. Stress, whether physical or neurogenic, cause increase in ACTH secretion by the anterior pituitary gland, followed increased adrenal cortical secretion of cortisol. Type of stress that increase cortisol release. Trauma of almost any type, infection, intense heat or cold, injection of norepinephrine or other sympathetic drug, surgery, injection of necrotizing substances beneath the skin, restraining an animal so that it cannot move, almost any debilitating disease. Anti-inflammatory effect of high level of cortisol. Cortisol stabilizes the lysosome membrane. Cortisol decreases the permeability of the capillaries. Cortisol decreases both migration of white blood cells into the inflamed area and phagocytosis of the damaged cell. Cortisol suppresses the immune system. Cortisol attenuated fever mainly because it reduces the release of interleukin 1 from the white blood cell, which is one of the principal excitant to the hypothalamic temperature control system. Stabilize lysosomal and cell membrane. Cortisol cause resolution of inflammation. This results from the mobilization of amino acid and use of these to repair the damaged tissue. Increase glucogenesis that make extra glucose available in critical metabolic system. Increase amount of fatty acid available for some effect of cortisol or inactivation or removing inflammatory product. Cortisol play a major role in combating certain type of disease. Rheumatoid arthritis, rheumatic fever, and acute glomerulonephritis. All these diseases are characterized by severe local inflammation, and the harmful effect of the body are caused mainly by the inflammation itself and not by other aspect of the disease. Cortisol does not correct the basic disease condition, merely prevent the damage effect of the inflammatory response. This alone can often be a life-threatening measure. So this is the rheumatoid arthritis, which can be minimized, or its progression can be prevented by the use of corticosteroids. Thank you. See you in the next lecture.